Welcome to our Queensland Health Web 2.0 solution presented by Daniel Holman, Jason Collier, Tarjan Jin, Nicholas Vinvin Shaw, and Joshua Curry. Queensland Health, sometimes known as QH, is an organisation that is funded by the Queensland Government. It is dedicated to providing a range of healthcare services for the public. This project aims to recommend an implementation of Web 2.0 technologies that will help relieve the congestion that Queensland Health is currently dealing with. Queensland Health has already begun using Web 2.0 technologies. Their current involvement includes Facebook, Twitter, and YouTube. Queensland Health uses these tools to share awareness and issues concerning the Queensland Health system. Currently, Queensland Health is in the midst of rolling out the new strategic plan between 2012 and 2016. This plan is to help align QH activities with the government policies and procedures. So how can our Web 2.0 solutions help? Queensland Health has identified areas within their system that are currently facing issues. These include congestion problems, overcrowding in hospitals, long delays for beds, and expensive fees. Using our Web 2.0 technologies, our solution aims providing support for those in rural areas who can't always access medical attention, whilst also being able to share this information to those who can't always get to a medical professional because of their time constraints. By implementing a wiki service into the Queensland Health system, our project aims at providing patients with access to information about diseases, medication, post-op recovery treatment, and more. The material will be created by specialists, doctors, and medical professionals to ensure the highest quality of standards. Using social media platforms like Facebook, Twitter, and YouTube, we can provide a platform for the community to support each other, share opinions, and distribute new and important information. The general idea surrounding the entire implementation is based upon the relief of the health system by significantly reducing the amount of generic questions asked. Doctors and nurses' schedules will be reduced, allowing for a more organised and less stressed system. This implementation will also grant doctors more time to focus on one-on-one holistic care. The Web 2.0 solutions would also solve issues regarding rural healthcare. A wiki and social media community would allow for the easy distribution of any news and information. The content would also enable rural residents to gain insight into medical topics without the need to visit their doctor, which could potentially involve hours of travelling. This project is expected to take 23 weeks. This will include 2 weeks of planning, design, and development of the wiki page. Another 2 weeks will be used to gather specific hardware and ensure the system is operational. Once the wiki is established, it will take approximately 15 weeks to have the articles generated by a healthcare professional. Then after this, it will take 4 weeks of required staff training so that they can effectively understand and run the wiki page. After all this, we will have 4 weeks of testing to ensure there are no bugs within the system and that it is ready for public use. Within the time frame allocated for this project, we used careful assumptions to estimate a total cost of $906,000. This of course will include any wages and necessary requirements that is needed to successfully implement a fully functional system. Using a return on investment calculation, we have estimated a return value of 98% within the first year of completing this project. Our expected outcomes for the project are some ideas regarding the successfulness and adoption of the system to our target audience. When the wiki and social media pages are launched, we must closely examine statistics to gain a perspective on the overall adoption of the technology in the community. We hope to see outcomes that resemble the following: a wide range of home users access medication information from their home, and Queensland Health staff will save a significant amount of time gathered from the reduced answering of generic questions. However, the expected outcomes also have bad predictions, and one such example is the content uploaded by users featuring racist or hateful material. Therefore, we must plan ahead and provide a dedicated team to constantly monitor the communication of the media. In conclusion, this project will utilise Web 2.0 technologies in the form of wikis and social media to target the amount of patients visiting Queensland Health Services. The solution aims at providing medical attention for those who cannot always get access to this information, whilst also sharing important information for those who require medical advice. Adoption of these technologies will encourage residents of Queensland and outside foreigners to pursue a healthier lifestyle.